with a wonderful integrated service that looks at the fertile journey for a couple from preconception care right through to their pregnancy. The service is a midwifery run model, and it really is the leader in Australia. We don't have any other service like this anywhere in the country. That service involves referrals from general practitioners. Those women and their partners will come through to our service with a history usually of infertility or recurrent miscarriage, sadly having continuing miscarriages. They'll come through, we'll review their clinical history, they'll come through the preconception care program, which is really looking at enhancing their medical history and making sure that they have the best pregnancy outcomes possible. We'll then review them, the midwives will see them and walk through with them on that journey of infertility, which is very challenging, and we take that job seriously, and we do purport to have good outcomes. So people do value the service that we offer. We know that, we hear some good feedback. We do know that people who don't avail themselves of infertility services in general is not because of the cost, not because of the treatment hardship, but usually because they have a very real desire to have a natural conception. And that's our job, that's what we see is our job here at the Mater. Over time we've grown into a research-based service, and this is to look at validating some of the work that we've done or we've got experience in. So our particular interest is running a number of clinical trials at the moment in the achievement of pregnancy and the maintenance of a healthy pregnancy and having a good outcome. We also integrate our service with our early pregnancy unit, which is caring for women with threatened miscarriages, and that those women with threatened miscarriages may be eligible for some therapy on one of our other trials. We work closely with our general practitioners, we refer back to them, and we're very thankful for them as being a good referral service. So research shows that generally women's awareness of their fertility, both during the course of their life and on a monthly basis, is an area of need for improvement. Even looking at things that will actually enhance or make pregnancy or achieving a pregnancy difficult. So our job here at the Mater is to walk women through that journey, instruct them in when they are fertile and give them the best chance to have a good outcome.
Hi, my name's Jo Costello and I'm the manager of the Midwifery Group Practice, commonly known as MGP, at the Mater Mothers Hospital. This model provides continuity of midwife for a woman throughout her whole pregnancy journey, through her antenatal appointments, care in labour and birth, and for up to 6 weeks postnatal. The women do have to live in the Mater catchment area to get this service, so that's really important for you to know when you're making the referrals here to Mater. This model is an all-risk model of care, which means that we do collaborate quite regularly with the obstetricians and the obs medical team. So just to let you know that, because we do have women who are diabetic, sometimes the women on our caseloads do become more complex, and in that instance we do remain primary carers, but we do involve the obstetricians more in our care. There are some specialised models within the midwifery group practice, and they care specifically for younger women, adolescent women, refugee women, and Aboriginal and Torres Strait Islander women. So the services look a little bit different for those groups, but still they do have a midwife who follows them throughout the journey. This model does support early discharge home from hospital, because the women get quite a lot of follow-up in the postnatal period. And we do get really good feedback about the support women receive at home. What's really important for us is knowing that as GPs you can refer to us really early, because we're quite a popular service, and so we do have some wait lists. So if you can get that referral in nice and early, that would be really appreciated. And you can actually indicate that the woman would like MGP, so important to have that discussion with her. The kind of women that really benefit from this model are women who are maybe isolated from family and friends, or might have increased psychosocial complexities. As part of the group antenatal care, the women all get together, so there are women due around the same time as each other, and so often these women will go on to form relationships and stay in touch after the birth, which is really nice for the women. They've got that support in their own community. So if you do have any questions, you're more than welcome to call us. Our AO is on 3163 1968, and she can put you through to me if you've got any further questions. Thank you so much for your time.
Hi there, I'm Kate, one of the midwives with the Birthing in Our Community team. Our program is a service that is for women who identify as Aboriginal and/or Torres Strait Islander, either the woman herself or if her partner identifies, or even if one of the other children within the family, sometimes blended families, one of the children will identify. They're all welcome to engage with the Birthing in Our Community program. Our program has several midwives that offer wraparound care. We provide antenatal care. We're on call for women during their labour and birth. So women give us a call when they're ready to come in to have their babies, or if they're requiring assessment during their pregnancy, if they're concerned about movements or anything else post 20 weeks. The service is excellent because it's a real wraparound service. So we have MARTA, IUI and ATSIX all as the umbrella to manage our care appropriately. We've got family support workers who do an amazing job with supporting women in a culturally sound way. We also have a psychologist and social worker, as well as access to physiotherapy. Pretty much if a woman has a need, we will find a way to fit that need. So it's very individualised care that is culturally safe. We also care for women postnatally, so after they've had their babies, they might discharge from the hospital, or they may require a longer stay, depending on their circumstance, physically and psychosocially. We then provide 6 weeks postnatal care as well. The referral process to our Birthing in Our Community program is easy. It's the same process that you would follow when you are referring women that are receiving other antenatal care at the MARTA. However, if you identify that the woman or her family members identify as Aboriginal and/or Torres Strait Islander, if you can mention that on the referral would be fabulous, and then we can provide the appropriate model of care for them.
Hello, my name is Jackie Freeman. I'm one of the midwives of the Refugee Maternity Service at Mater Mothers Hospital. The Refugee Midwifery Service has been running for 11 years now, and the success of the service has meant that it's continued to grow over time and is now split into 2 separate services. So the Refugee Midwifery Service has a clinic that runs as a midwifery group practice at Inala, so aiming primarily for women in that area. And we also have, and that's a select criteria, and they take a small caseload of women and offer continuity of care throughout the pregnancy. We also have women that come up to the hospital, and the Refugee Midwifery Service at the hospital does not cap its patients, so we'll see unlimited patients that require services. Throughout the time that the Refugee Midwifery Service has been running, we're actually seeing approximately 270 women per year servicing over the south side of Brisbane. The model of care offers appropriate and safe cultural care for women who come from different backgrounds. Often women don't speak English, or they've come here and they've been here for years, but because of their background and their upbringing, there's requirements that they need in the services. The service that we offer provides a continuity not only with midwife, but continuity with obstetric care, continuity with interpreters, a specialised social worker who can assist with emotional and also financial supports, and any other supports. The refugee model of care supports and educates women birthing in Australia. This is often advocating for women and their families, educating them on having babies in Australia, collaborating as a multidisciplinary team in complex health conditions, often with things like FGM, psychosocial supports, and emotional well-being. The model of care is not only for new arrivals, it's also for women who have been in Australia for years. The eligibility criteria includes women living within the Marta Mother catchment area. It's women who identify as a refugee or their partners have identified as being a refugee. On the referral, please make sure to state the refugee status, state the language that they require an interpreter in, and this just assists with our triaging. Finally, I'd like to say thank you for your ongoing support within the community.
Hi, I'm Emily. I'm a midwife for the CHAMP service at Marta Mother's Antenatal Clinic. What is it? What do we stand for? So CHAMP, it's a long word, but I'm going to read it out for you. So it stands for Continuity of Care by Health Professionals Attending Alcohol and Drug Problems, Meeting Mothers' Needs for Positive Family Outcomes. What does it all mean? I guess what you can do for your patients if they come to you with any of these problems would be what the patient might be using substance-wise and indicating on there that she would be best for CHAMP. We see women in a continuity of care model up at the hospital, so they see a midwife for every appointment. We have social workers that they are able to see for every appointment as well, and we work closely with the obstetric team and neonatologists also. We see women who are using alcohol, tobacco, other drugs, on opiate replacement therapy, or that's something that's been in their past as well, so we're helping with relapse prevention. Following on from that as well, postnatally, we would see them on the ward when they've had their baby, but also seeing them at home if they're in the Marta catchment area. We do sometimes accept out of area, but we just aren't able to see them at home. With that as well, we're able to introduce them to child health while they're here and start their referral process for ongoing follow-up with child health. We also have a CHAMP at Home service that we're able to refer on to as well for a 6-month follow-up and support. Thank you for everything that you guys are doing out in the community, and thank you for sending your patients to us so that we can help to also make a positive change.
Hi, my name's Fran. I'm one of the relieving midwives with the risk planning team at the Marta Mother's Hospital in Antenatal Clinic. The RPM clinic is risk planning midwife, and essentially we can care for women in a continuity of antenatal care model through clinic. We look after women with complex mental health needs, intellectual impairment, physical disability, Department of Child Safety involvement, domestic violence, or homelessness, or any other psychosocial concerns really. We're able to help support these women through that continuity of care model by knowing their story and working with them to help refer them into community agencies with our allied health team here in the hospital. We also work really closely with our social workers, Child Protection Unit, the psychologists, the Marta in Mind team, and the child health clinics out in the community. So we see the women here in clinic ideally from booking in history, so it's really important if you guys are able to identify any of these psychosocial concerns early on your GP referral into the hospital. They can then be triaged directly into our booking in histories to help facilitate that normalisation of the care for these complex women. If you're able to also identify on your referrals the sorts of care that you're able to provide out in the community, and we can certainly liaise with you backwards and forwards in helping to support with their mental health needs in their pregnancy. General referral process is exactly the same through the GP liaison midwife. However, if you are providing care for a lady out in the community and you do identify concerns, you can certainly refer to us for additional support via the phone system or the email. Antenatal histories are done in the clinic, and then if women are identified to have high risk concerns, can be referred to us in RPM for the remainder of their care. We are a midwifery service and have the obstetricians and allied health team to support us with the care of these women. We will then also follow them up postnatally with their home care visits to help facilitate that journey out into motherhood in the community. We certainly thank you for your ongoing support in helping to care for women particularly with mental health concerns by providing them with access through the mental health care plans to get community psychology support.
Hello, my name is Belinda Norman and I'm the Bereavement Coordinator here at the Mater Mothers Hospital. Very privileged to lead a team of 4 midwives and our job is to care for families when they've found out that their baby has passed away, either through miscarriage or stillbirth or neonatal death. We care for families from 12 to 20 weeks that deliver their baby on the ward, and we provide, as well as 20 weeks to 40 weeks. We provide practical support, so we guide families with choosing funeral companies, liaising with Centrelink, registering the birth of their baby, as well as memory creation and encouraging them to have time with their baby. We also provide emotional support. So I'm a trained counsellor and one of my colleagues also is as well. So we are very happy to counsel families while they are inpatients here at the Mater, and we do also offer 4 sessions after they are discharged from hospital as well. We have great contacts within the community, psychologists and counsellors that work in the space of grief and loss, so we can encourage families and refer families onto those as well. We're very grateful for your support and we thank you for your referrals.